Hi everyone! Thanks for tuning in to the NUS Nursing Research Podcast series where we feature the latest works of our brightest minds. I'm Dr. Jocelyn Chew, a research fellow at the Alice Lee Centre for Nursing Studies. Here with us today is Dr. Shawn Goh, an assistant professor at the Alice Lee Centre for Nursing Studies, National University of Singapore. He is also a registered mental health nurse with more than 2 decades of experiences in various mental health settings. Dr. Goh has published papers in many nursing and non-nursing related peer-reviewed journals with high impact factor. He is also a nurse clinician in mental health with the Assessment and Shared Care team at the Department of Psychological Medicine, National University Health System. Our topic for today is taking mental health education to a new virtual frontier, where Dr. Goh shares about how he makes use of technology, specifically virtual reality, to educate the next generations of nursing leaders in mental health. Hi Dr. Goh, it's so nice to have you with us today.
Thank you. Happy to be here too.
Right. So I know mental health, every one of us know the importance of mental health, especially after going through COVID-19 pandemic, right? I remember having to restrict my social outings, having to, not go out so much, and I even had to cancel my wedding. So I know it's very important for us to educate the next generation of nursing leaders in mental health. So you're going to share with us a little bit more about this today, right? So maybe first of all, can you share with us a little bit more about what you do?
Yeah. Hello, I'm Dr. Shawn Goh, an assistant professor from the Alice Lee Centre for Nursing Studies, National University of Singapore.
So I think mental health nursing is so interesting, and it's a part of healthcare that we don't usually talk about, right? So what actually inspired you to dive into this aspect of healthcare?
Mental health is always something that is close in my heart. It is an issue for many people as they face with stressor and challenges in their life. This has especially become important as we transit out of the pandemic. I have been a nurse for more than 2 decades. Seeing people struggling with the mental health condition when I was working in the clinical area reinforced my interest towards providing mental health care. It was in my early days in nursing when I first got the opportunity to see how a mental health nurse played role model for a patient who was trying to gain control over his anxiety condition, which affected his life tremendously. The nurse was able to journey with the patient until he became more independent and started to reintegrate back into society. Now at a level I can effect a change in teaching mental health nursing to my future nurses, it has become important for me to develop a successful and sustainable method that will equip future generation of nurses with the knowledge and skills to provide mental health care to their patient. Therefore, we constantly improve our teaching pedagogy at NUS Nursing by innovating and experimenting what works best for students' learning.
Right, so I know that to teach mental health nursing more engagingly, you have developed a very comprehensive learning package called MAGIC, which is the short form for Managing Aggression Using Immersive Content. Is this an online platform?
Yes, MAGIC is a consolidated blended learning program which includes didactic lectures, role play, using virtual reality to learn, followed by a debrief session. This is a 3-hour learning workshop. Before I elaborate on MAGIC, I need to go back further into how I got started with it. The whole blended learning approach started in 2019, together with the Department of Psychological Medicine at NUS Nursing, where I led a team to develop an empathetic care and response program, or eCare, a hands-on workshop teaching medical and nursing students how to manage an aggressive patient in the ward. Many times in the clinical setting, students verbalize that they are not confident when they need to provide care for patients who exhibit aggressive behavior. So with eCare, students were first given a didactic lecture on the theories related to aggression, how to recognize it, how to de-escalate the potential aggression, and finally, how to use rapid tranquilization to manage the aggressive behavior when needed. During the hands-on session, students are brought to a simulated ward environment where they are shown videos on walking confidently with a client with potential aggression and de-escalation techniques. They are then encouraged to practice what they have seen on the video with the supervision of their tutors. Finally, they were allowed to practice and experience physical restraint with someone holding them down, being restrained using limb restraints. Students during the practice were all excited, especially when they are allowed to practice the physical restraint under the close supervision of their tutors. One of the most memorable feedback that I received after the session was, I would never want to subject my patient under restraints unless it's absolutely used for their safety. And another student told me, I felt so vulnerable being restrained even though people around me are my friends. I can imagine how terrified patients would feel.
Right, that doesn't sound pleasant at all.
Precisely, you're right. This experience helped us to reinforce students that restraint should be only used as a last resort. After the session, students report on increase in their confidence and empathy level towards patients with aggressive tendencies as well. At the same time, as tutors, we began to explore the possibility of having a simulated ward environment where students can experience what they will see in an actual ward setting. At that point, we were thinking of using an actual simulated ward setting with multiple simulated patients playing their individual roles while having one of them starting to become aggressive. A simulated ward environment may be the most realistic. Students can experience the seriousness or the depth of the situation that can occur even in real life. However, the overall cost and logistic arrangement can be daunting if you want to train the entire cohort of nursing and medical students. With that in mind, our team then brainstormed and explored how else we can answer this learning need. What we wanted was to have a teaching pedagogy that can provide us with an authentic learning environment and be sustainable in the long run. Therefore, in 2021, we jointly developed VRAM, Virtual Reality in Aggression Management with the Department of Psychological Medicine at NUS. This is the first virtual reality learning platform in Asia where we harness the use of virtual reality for students to learn how to manage aggression in the ward. This was a further enhancement to eCare, our hands-on session. Together with eCare and VRAM, NUS Nursing and the Department of Psychological Medicine officially started MAGIC, a 3-hour blended learning workshop for aggression management.
Right, I think it's so wonderful that you actually, bring the medical students with the nursing students together. So what actually happens in VRAM? Like how I as a student can use it?
VRAM provides a totally different approach as students are able to see and act as a doctor or a nurse to experience for themselves how they could manage a potential aggressive outburst of a virtual patient using the Oculus Quest 2 VR headset. We run this program with 98 nursing and 60 medical students at NUS Medicine as part of the learning module. In the scenario, students played the role of either a nurse or a doctor where they will encounter Debbie, a main character in the VR. At the start, students are brought to Debbie's bedside where they were introduced to her. After a while, the student will be immersed in a very real environment. For example, a noisy ward with the television switch on, a telephone ringing, dissatisfied relatives asking questions, while Debbie becomes unmanageable. During the entire VR session, students need to recognize the importance of situational management in the ward. They will be required to make the necessary judgment calls and decisions as the situation unfolds. At each juncture presented, there is a time limit for every decision to be made. This makes the VR scenario more realistic. A wrong decision at any point will lead to a bad outcome. Some outcomes are very real, as it can be having a patient absconding from the ward or having relatives taking video clips as the situation progresses and post them on social media.
Right, wow, that sounds like a very terrible situation to manage, right? So what did the students mention to you about their takeaways from this?
At the end of the MAGIC workshop, after they have gone through the eCare and VRAM training, tutors will spend time to conduct debriefing sessions for all participants. Some students noticed one important cue in the learning session that they did not notice at the beginning. This was a family photo of Debbie, the patient, with her daughter placed on her bedside. If students were to pick up that cue, they could have defused and de-escalate the entire situation by diverting Debbie's attention back to her family. This would have reinforced to students the importance of providing empathetic care towards their patients. Furthermore, using virtual reality, we were able to allow students to make mistakes and replay the scenario, allowing a consolidated learning. As a team, we are currently evaluating the learning outcomes for the students for MAGIC. Anecdotally, students are happy and satisfied with their learning experience, with reported improvement on their confidence in managing aggression when they encounter it again. They also mentioned the importance of situational awareness and empathetic care for their patients.
Right, so I think being able to learn from your mistake, for example, through a program like MAGIC, which is a combination between VRAM and eCare, right, allows for this. So I know that to develop a technologically enhanced teaching pedagogy or teaching intervention is quite difficult, right? So I'm curious about what are the challenges that you have faced. Can you share with us a little bit more about that?
I think the main challenge in project development is especially when most mental health programs or such training programs coming from off the shelf are usually not catered to a local audience. This limits the realism of the program, which may eventually hinder students' learning.
Right. So why do you feel that there's a constant need to improve on your teaching pedagogy?
For 5 years, I've focused on improving pedagogy in mental health nursing curriculum to improve students' learning experience, increasingly by incorporating technology. During our tutorial session, students will always ask how and what patients actually experience when they are having mental health condition. So many a times, I will try to describe what we can do. But with technology, I now can bring more realism into learning. It will never be the same if you can experience it for yourself.
Right. So would you have other projects in the pipeline, or are you thinking of any other things in the mental health space in terms of teaching and pedagogy?
Yes, with technology in place, I'm now exploring the contents within the curriculum and hopefully across different pre-registered healthcare students. And I hope that I can make refinements to the curriculum so that we can better prepare our future healthcare workers. With the advancement in technology, educational pedagogy used in mental health nursing that are now changing to incorporate authentic learning in our daily classes, these changes have allowed us to provide real-life learning experience for our students.
Thank you, Dr. Goh, for your wonderful sharing about how we can make use of technology, specifically virtual reality, to enhance our students' learning experiences. Interested students out there, if you are listening, come to our school to experience this firsthand. You've been listening to a podcast on taking mental health education to a new virtual frontier, part of the NUS Nursing Research Podcast series. With us in the studio was Dr. Shawn Goh, an assistant professor at the Alice Lee Centre for Nursing Studies, National University of Singapore. I'm Dr. Jocelyn Chew. Thank you for joining us in this episode, and stay tuned for our next podcast.